It can start anywhere in the body, from bacteria, fungi, or other microorganisms. Over 17 million people contract one, and up to 500,000 people die from one or with one each year. Chronic infection.
Everybody knows what an acute infection is. That's strep throat, it's an acute pneumonia. You give a single antibiotic and it's one and done, it's over. Chronic infections, we know those too, and we think it's just more of the same bacteria, but it's radically different bacteria. And that bacteria can infect any tissue, but it doesn't respond completely to antibiotics. It's outside of host control, and therefore it can reside for long periods of time, resulting in the loss of a body part or, unfortunately, loss of a life.
Everyone knows that heart disease and cancer are devastating diseases, yet there is good evidence that both diseases may actually be a result of chronic infections. Almost every tissue in the body can be affected by a chronic infection.
All of us know what a chronic infection is. It waxes and wanes. You get antibiotics and it gets a little bit better, and then when you withdraw the antibiotics it comes back, and that's like sinus infections or chronic tonsils or Crohn's disease, cystic fibrosis. Every organ system of the body can be affected, and we all know how that it eventually ends up. Usually the body parts get removed. It's the tonsils come out, the sinuses get stripped, and for wounds the leg gets cut off. So chronic infections can lead to not just death, it can lead to quite a bit of suffering and then death.
Most chronic infections are treated with episodic care until the tissue is degraded to the point where it's removed or replaced. The ability to diagnose chronic infection and treat them effectively before tissue is so damaged that it needs to be removed could revolutionize medicine.
And what we've seen is with molecular diagnostics, when we diagnose the sinuses, the ENT doctors are more focused and they have better outcomes. When we diagnose those tonsils, they may not, so far, they may not end up with removal. So we know that if we can specifically diagnose the bacteria that we're dealing with the chronic infection, that the clinician is much more effective.
Biofilms have now been identified as the cause of chronic infection, and there have been tremendous advances in the understanding of how bacteria behave in these biofilms at the molecular level, and how biofilms interact with the host to produce chronic infection.
We all know what a biofilm is. We manage them every day. If you're in the bathroom and you're cleaning the toilet, your tub, your teeth, you're managing biofilm. The scientific definition is when bacteria find a surface, they attach, they form this gooey substance over themselves, and now outside forces don't affect them. So acute infections have strep and staph and Pseudomonas, where in a chronic infection, all of those are in there together at the same time, so that they're in a community with community defenses. It's impervious to antibiotics and antibodies, white blood cells, which makes them very difficult for us to manage medically.
Scientists at Southwest Regional Wound Care Center in Lubbock, Texas, have produced some of the most important and pioneering research in wound care over the last decade. Together, they have developed molecular diagnostics that are now being used by physicians around the country and even around the world.
Our scientists have developed different molecular platforms to identify bacteria and, more importantly, to quantitate how much bacteria is there. So our ongoing contributions are going to be developing and exploiting any new molecular technologies that come out, and all with the focus for identifying bacteria in chronic infections to give the clinicians a tool that they can manage these things.
The Southwest Regional Wound Care Center is the only freestanding wound care center that is dedicated to personalized care for each patient to heal their wounds, no matter what it takes. Under the direction of Dr. Randall Walcott, the staff is passionate about healing its patients, which has resulted in Dr. Walcott's quest for the best medical advances in wound care.
I was working on a water trough and got my foot infected. And they took me to the hospital in Lovington, New Mexico, and I stayed 5 days. And then they sent me to Covenant in the ambulance. I didn't even know I was coming. I was really sick. And I stayed in Covenant 6 days, and I wasn't getting any better. I got up and left the hospital and came to Dr. Walcott. And I've been, like I said, I've been coming since May 21st, 2010. I came 3 days a week for almost 6 months. 2-hour drive. Dr. Walcott and his staff have been amazing to me. And they have saved my foot, there's no doubt about it.
The most dismal thing that I've ever heard is when a patient is told they have a chronic disease, and we're not going to try to cure it, we're just going to try to manage it. And there's not a doctor around that wants to give that diagnosis or that information to the patient. So what we want to do here, our passion is we're going to develop the newest and the greatest molecular technologies, and we're going to identify these bacteria for these clinicians, and then hopefully participate in developing those effective and efficient treatments. And we're going to try to cure chronic infections and not remove body parts.
I had like an ingrown toenail, and it got gangrene, and I went to this doctor. He said, well, we need to take you to the hospital and cut it off, or if you don't take care of it now, you just have to cut your whole leg off. He also referred me to Dr. Wolcott, and coming out here, he said, this was real promising to me. He told me around here we don't cut legs. We try to stop the infection, try to do the best we can to prevent that. And I was real grateful for that encouragement. I wound up losing my toes, but I didn't lose my leg, and I was like real grateful for that.
The Wound Care Center is not only a wound treatment clinic dedicated to wound healing, but also has developed a relationship with a pharmacy which creates topical treatments to encourage wound healing. The pharmacy scientists are constantly researching new ways to mix novel ingredients to fight bacteria and stimulate the healing process.
The way to impact the healing of chronic infections is to diagnose them. And using 150-year-old technology isn't going to get us there. The new molecular methods have clearly shown that they can identify the bacteria and the other microorganisms that are there. So I think our contribution to this is that we will develop the new molecular methods, we'll exploit any advantages they have, and clinicians will get accurate information as quickly as possible in real time so they can manage those infections.
The increased understanding, accurate diagnosis, and effective treatments of chronic infections may have a significant impact on the treatment and prevention of diseases like heart disease and cancer. To learn more about Southwest Regional Wound Care Center or to make an appointment, call today or visit woundcarecenter.net.